So first we read role and meaning of communication theory in medicine, history and today importance. Yes, for sure you remember that we begin from the Hippocrates, its oaths and other kind of portion, which is in medieval period, how it changed in the early 20th century, and now what is nowadays importance of this communication. Yes, what is a new point in communication skills. Okay, doctor-patient relationship. So the relationship it's confidentially and kind of relationship when the patient is the main point of the subject, when disease of the patient is the main and a patient is not the main portion, when a relationship is like paternal, when doctor is like parent for the patient, you remember, or colleague, it's different size. Yes, when confidentiality must be between two persons, when in confidentiality must be the third person involved. Do you remember this point? When and how we compare, how we understood which kind of confidentiality, excuse me, I will stop on this word, must be. You remember, here is different kind of person. At first, normal mental organization, middle age, intelligent person, who is on the same step, on the same level as you. But if you remember, I always say that we have to understand what kind of person is in front of you. To speak on the language more suitable to this person, to understandable to this person, yeah. But it's not only about the understanding of the speech of the doctor to the patient, but as well you have to understand what kind of background has your patient to make some decision, because sometimes happen that I do not want to say something very bad, but not so intelligent person must have someone who will protect him, who will take care about this patient. Who can be mental disability is kind of portion is an autist patient perfectly. Yes, a patient with autism, it's not disease, it's stages and development of the personality. Here can be some diseases which take changing in the mental organization of the patient as well. Can be some disease, not disease, but period of life, and it's depression or other kind of changing in the mental organization, which can lead to dramatical avoiding of the treatment or other kind of changing. So next, with the age change, the mental, like dementia, you remember dementia and Alzheimer is two different kind of, but something similar is because memory of the patient has some problem. So if in dementia it comes from the age degradation of some structures and tissues inside the body, so in the Alzheimer it's perfectly in communication kind of between the structures in the brain and other point. Yes, so memory and brain. So and as you remember, Alzheimer is when the patient forget new information. So that's why, yes, in both of them, mainly they forget new information. So in this kind of patient, of course, we have to take the third person who must protect our patient. But here will be problem with which one, my dear? Confidentiality, yeah. So you have to choose this person with very carefully. Can it be someone from relatives? Of course, if patient, will name someone, why not? Yeah, so if you really depend on this person, if this person comes from a relative circle of this our patient, why not? But sometimes happens that we use some other person from juristic kind of person who will protect. Yes, so by rule happens sometimes that in the pubertant, after pubertant period, in the period till the adolescence, yes, till the person became adult wise and can do some decision by himself, is a period when by law they cannot do it. So in this period, maybe this person have no relative at all. It happens sometimes the person has no relative. Yeah, so in these cases, we have some juristic person who will lead, who will be the medial portion between the doctor and patient, who will take care and follow all the prescription and help our patient to follow this prescription and to do decision. What kind of decision we will speak slightly later. So you remember. So this is the second lecture that we did in the very early hour meeting. So what is doctor-patient consultation? Essential elements for communication. So how consultation must be, how it must be done. So you remember we begin with organization of the room, how you enter, how you must be dressed, dress code. You remember what is dress code? That as I see, it's perfect. The hood on our sanad. It's great picture, my dear, but I think when you will meet your patient, you have to change or take some code, white code on your perfect and so stylish dress. Yeah, why, my dear? Dress is one of the points which makes communication with the patient. You remember that communication is verbal and non-verbal as well. So non-verbal is from the dress code, which you show the patient, yeah. And one of the most important point is how you look, your look. So in main countries, it's light colors of the coat for the doctors, mainly white color. Nowadays, it's some differentiation between the surgery, cardia, and other kind of parts of the hospital where they use slightly different colors. But in any cases, it must be clean and not how it is English, everyday used. Yes, so it's a special hospital dress or ambulance, how it will be, where you will work. Why? At first, when it is clean and light color, it makes you light and you somehow relay to begin to understand that you can rely on this physician and so on and so on. Something happens in your brain, yes, in your mental organization. Then when it is light color, all kind of spots it's seen on it. So it means that your patient understands that you protect yourself from any kind of viral, microbial, and other kind of problems. So you are clean, you are protected, you are you think about your safety, so you will think about your patient as well. This you remember. So about the dress code, and in different hospitals different dress code, but for sure it must be light and very interesting kind of. So The next one is your place where you are sitting. Of course, I do not want to repeat that it must be clean, organized, that you have to change something on it. It must not be a lot of subject on your table and so on. So it your patient must understand that he speak with very organized person. Yeah, for sure. Then we speak about how your patient come in and what you have to, how to make suitable the situation and the room for your patient. You remember I say that you have to close the door, open the window, give some glass of water to your patient. Why, my dear? If your patient is nervous, aggressive, and other kind of shy and so on, you have to make communication. So what is communication? Not only word, non-verbal as well. Yeah. So non-verbal, clean, suitable place with dress code of the physician. In front of the patient, you clean your hands and change the clothes, take the new mask and so on. After this period, you calm your patient down. You give 2-3 minutes to patient to calm down, but if not, you have to calm your patient. How you work is you have to give some point of here you remember, and it is in the presentation, 6 step of the communication, and if you will recheck the videos which are uploaded here, 6 step of communication with the aggressive patient. I uploaded it as I remember, but for sure, the first of all, you have to make connection like you take care about him. It's very easy. You only ask if it is hot, cold. Does your patient need any water, or I do not know, maybe some fresh air and so on. Yeah. So it's enough to patient to understand that you take care about him or her. That's what we do. So what else? Then the style of communication. Do not jump from portion to portion. It must come from by list. Thanks God that nowadays you have specific guidelines for it, and every hospital will give you questionnaire as well as history, taking some procedure lists where everything is prescribed. But in any cases, in the beginning, you give 2-3 minutes to speak and do not take it in attention. Why? Because what I say, the first minute your patient speak to you, he want to take expression on you, so it means that he lying. Yeah, mainly 80%. Not full lying, but somehow. So what you will have? Give this 2 minutes and then takes away. You need to communicate. So questionnaire your patient. What kind of question you will give? You will give some specific question, beginning from the main point why your patient come here. What happened? Perfectly, it will be 90%. It will be some pain kind of, because in otherwise we are so lazy. Persons are so lazy to come to hospital to physician. So, but if it is pain which we cannot manage, so we are scared and come to the physician. We doctors as well. The main symptom will be the leading symptom. 90% of the patient will name pain. So after this pain, you will take what you will take. Description of the pain and note it for sure, because yes, I think you remember, your memory is great, but if you have more than 10 patients per day, you will mask all the symptoms with other person after a period of your life. after 1-2 years, you will mess everyone for sure. So the best way to not to make any kind of mistake, and you remember we spoke about the mistakes, yes, that can be done. You have to know this. What else? You go from which part of history? Remember, history is nowadays what's happened. Then history of medication. So what's happened with your patient in the previous period? Did he have the same, similar, or not similar problems? Which kind of treatment was from the birth period till nowadays problem? Then. Uh, Medical history. Then it will be family history when we need it, because a lot of diseases are or viral and microbial, which can be in the close circle with the patient. So it's relative and one house and one building and nearby persons who are involved in process, or it can be genetical as well. So comes from the gene which has similar family members. So it may be aunt, uncle, father, grandfather, grandmother, and so on, who has the same, or sibling as well. So after family, you will go to the social history. Social history is a very interesting point of. It's not because we are interested in the life of our patient, but because we are interested in the person who are near our patient. So some habits, some lifestyle of these neighbors and relatives and social person, friends, and so on will give us understanding of patient's problem. Maybe depression, maybe alcohol taking, maybe drug addiction, and so on, which is covered by our patient, will uncover when we begin speak about the social history. Some problem can exist, and light it here, light up here perfectly. Then you will go through the examination, all system and organs, and all system and organs will be examined in different manner. All the problem must be writing down in your computer, in the notebook, everywhere you need, but bullet by bullet describe not full organ and not full system, but the point you find out. So is it spot on the skin? You will describe it. Not like, oh, skin is thick, normal, somewhere we have some. No. Thickness is strength of the skin is, I don't know, this kind of. Turgor is normal, this is normal. In the upper limb, left upper limb near the shoulder was found spot, and describes the spot. Spot is round, dark, and so on and so on, as it is given in your directive in the Bates book. You will study it later, I think, but for sure, or it will be given by guidelines or schedule in your hospitals, which you have to use for description. So bullet by bullet, all new information will be noted and write down, and only after full examination and then laboratory examination and additional kind of examination, we will give diagnosis to the patient. Okay, this is easy for us. Consultation. So what kind of consultation can be? Consultation can be private, like we say that patient come to the ambulance or to hospital, meet you, and you do this consultation. It can be by internet, and we will speak later about it. We'll repeat it. It can be by mail as well, consultation, why not? So different kind of consultation can be, yes, but mobile as well, it's named consultation. So, okay. Developing skills in information gathering. core task of clinical communication, information gathering. So these two parts are very common when we begin to speak. You now have to understand how we have to communicate. If you remember, I record some videos for you through our lecture, where it's perfectly seen that when you speak with a patient with dementia, maybe with patient with a mental problem, in the beginning it's aggressive kind of communication between the patient and relatives, and how to manage this one. You remember that they need only care, not protection, not leader in the relationship, but someone who really care about them. So, but never mention that patient is ill or cannot afford some kind of manipulation, maybe. So you have to manage this process very interesting way. Every patient, every doctor has its own way to communicate, but always you have to make connection and then take patient on your side. So as well, you remember when I gave you video with pregnancy person and person after childbirth, some aggressive from this young mother comes when nurse describes the position of her job, and it takes some misunderstanding between the patient and nurse, and aggressive action comes from the patient. You remember, yeah? So how to manage this process, how you have to work in this situation, how to calm patient down, how to smile is very important as well, is a part of this moment as well. Okay, let's go down. Information sharing and shared decision making. Oh, shared decision making. One moment, my dear, if I find it. Shared decision making. Let's pick some, yes, this one. Take this one slightly deeper, and another one here is as well. This and this. I do not remember which is. So this is easy one, and then we will go to this one over another. It's better. So share decision making, what it is and how to manage. So what is share? Share, when you are not alone, you have to compare, to share some information with your patient, which information must be shared, which not, how to share, or what is decision, why you give permission your patient to take decision. You remember we spoke about it, but let's take once a look for it. So you have to, by the rule, share information with your patient, for sure. It's 21st century, and nowadays a patient has all rights to know what's happening. It was in the mid-ages, in mid-centuries, medieval period, when patient was nothing, and we treat like subject with some diseases. Yeah. So nowadays, patient is a person who manages the treatment process for better result to take. So decision making. Decision making is not only the physician but patient as well. how, if you remember, we spoke about it. I said that you need to communicate with your patient to understand which kind of medicine to take. Maybe sometimes it's better to take injection, or sometimes it's better to take some tablets. Yeah, when to take, after the meal, in front of meal, in the middle period of the meal, and so on and so on. It can be as well decided and taken with the patient in consideration. Shared decision making is when health professionals and patients work together. This puts people at the center of decision about their own treatment and care. During shared decision making, it's important that care treatment options are fully explored. Where's the slideshow? Better. Come on. What's happened? Okay, didn't want what to say. So, options, key of treatment options are fully explored along with their risk and benefits. Understand? Yeah? Different choices available to the patient are discussed. Decision is reached together with the health and social care professionals. Understand? Both people receiving and delivering care can understand what's important to the other person. People feel supported and empowered to make informed choices and reach a shared decision about care. Health and social care professionals can tailor the care of treatment to the needs of the individuals. The care and support you receive should take into account your needs and preferences. You have the right to be involved in decision and make decision about your treatment and care together with your health or care professionals. Patient decision is support conversation and help patient make informed choices. The same, yeah. Okay, so it is very important to do it together. What else can be said? So, at first, it's ethical principles. Yes, when you share information, it's a portion of your ethic of communication. So you take the patient on the same level, the same stage as you are. In this period, in this moment, it's only one problem that you have to you have to describe patient some problem on the language your patient will understand. Remember this point? I think yes. Yes. So patient must understand your speech. It must not be high medical language or Latin as well. So you have to describe the portion. It's ethical. Why we share decision? How to say? So one of the point in the decision sharing is that you have, after you describe some problem when you speak with the patient, You have to give patients some time period. Why? Patient will want time to study new information, to consider their personal preferences, particularly for futures that are unknown to them, to think about outcomes, states that they have never experienced. Deliberation may in part be done outside the clinical encounter. Also, often patients wish to consolidate their new views with a trusted clinician. Sometimes happens it needs another clinician to communicate with, to compare these ideas. Individuals often want to discuss options with others, and it would be best if those involved could potentially use the same information resources. So, recognizing this need and allowing time for it is a cornerstone for effective work in this decision making. The model also includes the use of decision support interventions, which summarize information in formats that are accessible to patients using the most up-to-date evidence about the harms and the benefits. Some tools also include preference clarification exercises. Decision support for patients can be in a concise format, such as in brief text or diagrams, and used during encounters to initiate this kind of decision making, shared decision making. They can also be extensive, typical of the many tools already developed. Booklets, websites, videos, DVDs as well, my dear, can be used by patient. The family and friends member outside the encounter and at different time points. Understand, yeah? What about the deliberation? You share information and now you are waiting for decision. We use term deliberation to describe a process of considering information about the pros and cons of the option, to assess their implication, and to consider a range of possible futures, practical as well as emotional. This deliberation space, colored gray in the figure, encompasses the need to work collaboratively with professionals as well as with a wider network that patient will use. Deliberation begins as soon as awareness about option develops. The process is iterative and recursive. What comes then? After deliberation comes discussion. What is the differences? Deliberation comes when you speak with other persons and take something in mind. Yeah. And what about the discussion? When your patient understood all pros and cons, takes some decision for himself, then he will discuss it with you. And here will be another step of communication and another comparing of pros and cons, because you, like a professional, has another view on the disease and treatment. Patient who is not so educated as you in this subject, in this portion, can do his own vision, his own way information to you. But you have to change it if it is not useful to patient, or it makes more harms and uses to the patient. So it's another step. Sometimes it's not only two steps, it will be more than two, till the decision will be taken. Understand, yeah? As well, do not forget that in the sheer decision making, when your patient went out of the hospital, he will speak with other clinicians, as you remember, in the similar portion of the medicine, yeah? But here will be some conflict of interest as well. Someone will give some other ideas more suitable to them, not to your organization or you perfectly, or your treatment perfectly. So that's why we gave permission to patient to go out to take. That's why we need some booklets, DVDs, and some sites which will be useful and take patient on your side, your ideas, not others. So when you give this idea about the decision making, you have to compare with your patient some information that you have, books where he can read it, sites where the best way describe these portions, the way your hospital or you need your patient to understand it. Okay, or some conflict will be. Okay, this is another point which we discussed. Now, my dear, you can as well use your books which are given to you, but as well, oh my god, you can use this site. I like this site. Which one is it, my dear? You can see it here. Resources, how to NCBI. You can find some information about the shared decision making, perfectly good described here. A model for clinical practice. If you read it fully, it will help you in the exam for sure. So let's see else. So where we are, information share. Yeah, okay. The next one was medical errors and complaints. As you remember, we gave you this point by the presentation. I think it's good presentation. Why not? Let's see how it will be. It's uploaded for you. Okay, next one. Some errors can be patient complaints, how to answer, not answer, and so on and so on. So next one. Responding, yes, who is responsible? It may be perfectly the person for whom it complains, or some organization fully. It's given in your presentation. Cultural diversity, communication, and health. Identifying and dealing with cultural peculiarities in medical practice. We take some common question in our discussions, in our lectures about the cultural problems which can exist. You remember we spoke about the men-women communication in different countries when non-verbal and sometimes verbal communication can be understood by the patient in a wrong way. How to communicate with this kind of person, how to take the third person in the conversation in this point, and so on. That cultural, habitual, and religious kind of problem can exist as well. So, which one perfectly? In some countries where women cannot speak with the men, in many cases. That's why they are shy and silent as well, and you will take it like symptom or mental disease as well. So this kind of communication with special population, families, children, elderly, disabled, and mental as well. Yes, we spoke about it. It's given by presentation in your portal, on your portal, excuse me. So what is problem with children? That you cannot manage their habits and you cannot describe the problem to the children in the way you need it. So then in elderly it's a dimension and changing in the mental organization, and that some new ideas and new information is very difficult to understand by the elderly person. Why? Because they're habitual, how to say, their lifestyle is not the same. Like nowadays everything is changed from day to day, so you have to remember about it and give information in the suitable way. Disabled person is can be some problems with the mentalist way, because here is some ways that you have to speak or not to use the word. So not vehicle used person, but per person who has some specificity of walking and so on. Yeah, you remember. And mentally ill, where perfectly we need some the third person who will be translator, or how it will be. Suitable person, okay. Situation role play on end of life issues, you remember, yeah? End of life as well is given in the presentation for you. So read some, here some points that we cannot change and how to work with this kind of patient. How to prepare a person, how to manage the processes, and how to fight till the end with the disease, and give some how to impulse to your patient to stay alive. Okay, what else? Intra-professional communication as well. I give you, as you remember, here is not one person only, but you have to communicate to other persons, and how to make decision, how not to take conflicts in the communication. We will later, next our meeting, once again I will give this kind of conversation about this one, and the end is role of media and internet as well. We spoke about the internet. I remember here is uploaded one good presentation about the role of internet with some points and some questions in the midterm is given to you from here as well. Okay, so the main idea of today, our meeting, is to understand if we miss something, is uploaded all the presentation or not, and what you have to study. So you understand that question which you will be given will be multiple answer, not only one answer, but more than one answer will be right, my dear. About the portions, so better to read book. I understand that it's difficult to you, but subject is subject. Okay, only for pass. Follow my lectures and take some information from the sites as well. I gave some site to you. So let's see what we have. Let's check what kind of question can be. Case pro process. You remember it's easy. During the course of taking history, an example of confrontational response would be. How do you think what it is? T can see that you have been through a lot. I have been through this very thing myself. You are looking very upset. What is happening? How terrible. Which answer is right? At the beginning of an initial interview, the patient wants to discuss his perception of why he felt ill, but the interviewer wants to know the chronology of his symptoms to complete the history interview. The interviewer should, what he should, politely interrupt him and continue with closed-ended question, allow him to complete his thought, inform him that time is of the essence, inform him that an extra charge will be made in more time is needed for the interview. How do you think which is right? Guys?
B.
D?
B.
D. Second one. Let's see. Wait a second. It do not show me. Why is happening? Yes, you are right. Of course, my dear, as it's in here. Okay. Children who can understand the principle of conversation are likely to be in which Piaget stage? Oral, concrete operation, anal, sensorimotor, latency. How do you think? Okay, next one. It's very difficult to. When a doctor is interviewing a patient, the perceptual filter of life experience, self-image, values, and prejudice, biases are occurring only within the patient, make little difference for the doctor because she or he is in the professional role and can see beyond them, are occurring only within the doctor, may occur both with the patient and doctor, occur primarily when the patient has a psychiatric condition. How do you think?
B. The second one.
Let's see. Boss. with the patient and doctor. No problem, my dear. This kind of, I think, but easy one. I will try to take easy one from this one. I will give you maybe 3, 4 from this side, 3, 4 from some different. I will change, of course, the question, make it more suitable to our presentation, but this kind of question will be okay. I think it will be interesting and easy to do on the midterm. So, do you have any question for today our lecture? So it's overview of the part we did. I have no idea if I missed something. So if you think that I missed something, better to say it now, and I will prepare this part for next hour meeting. Okay? If somewhere you think you are not so deep in the subject, give me information, and next hour meeting, I will try to make it easier for you. Not only from the slides, maybe my dear, it's uploaded some books as I remember, but slides might be studied by heart. If you want only to pass, so 50.5 maybe. If you need good marks, better to read deeper, take understanding of the subject, and so on. So I describe only common idea about the subject. Yeah, more deeper it's given in your books. So do we have something to speak? Is not it uploaded on the portal? I will ask Salome Chiburdanidze to check it. For sure, all the question I will give you will depend on your how it is presentations for sure. So maybe some 1/3 of them will be slightly difficult. 1/3 will be very easy, like from this propose kind of, but suitable to our chat and our lectures. And 1/3 will be middle, where perfectly the only difficulty will be that we have multiple answers. Okay. Even the slides, I could not find them. I had to watch the videos for the midterm. Okay, I will ask. I perfectly will ask. In any cases, so 3 of presentation done by me, I will send to Salome once again, and others are perfectly, you can find in the folder medicine, elective subjects, communication skills, and here is uploaded a lot of how it is presentation. You can find them here about internet communication, about the end of life, communication with children. As I remember, is here, and something else like this is here. Okay. Let's see. You will go on the drive. I have slightly different. Follow me. Share it with me. Okay, it's in your how it is portal as well. See, here is medicine. Open it. If not, I will ask, you will ask Salome to open it. Here is by semesters of the subject. You do not need them, my dear. And here is elective subject or perfectly elective subject will be. See, communication skills in medicine as well. And I take some presentation, use some presentation from here. Internet and relationship, you see, communication skills in medicine, which else? So something, communication in working with special population, yes, is one. And interprofessional communications, this three is here, see? You will open and here is given all the portion. And we will once again, this presentation I will use next our meeting, and it's ninth week portion of information, and we will speak about it, okay? Not all of them, I have no ideas. I will ask Salome because she uploaded this presentation, and I will communicate with her, and once again I will check it, because when I send something I think that it's uploaded. Here you understand me, but sometimes it's portal problem, technical problem, like today half an hour I miss in some problems or organizations, that sometimes it's visual, sometimes a voice problem, and so on. Something happens technically sometimes. And a lot of videos is disappeared, like yesterday my lecture, not for you, my dear, health assessment disappeared, so I have to do it once again. Can you imagine? And some other kind of happens. It's technical issue, sometimes happens. Maybe it's my fault, I pressed something, maybe it's a fault of internet, I have no idea, it does not matter, but happens sometimes. I will check with Solomon and will try to upload all the presentation, especially in your folder. If not, as I say, follow my prescription and find some of them here in the folder of medicine. So what else, my dear? Okay. Do you need something? Okay, thank you, my dear, for your attention, for your time that you spent it with me. Thank you, my dear. If you have, goodbye, my dear, goodbye. If you have no question, I think it's enough for today. Goodbye.